Welcome back to New York Links. We have more from the Caribbean American Outreach Association's medical mission. Check it out. Another location that the CAOA visited was Belvedere, Kingston. This community was one of the poorer communities in West St. Andrew, and they were in dire need of the medical services that this organization had to offer. We're here in the waiting area at the Belvedere Community Center, where the Caribbean American Outreach Association is having their health fair today. And as you can see, it's a large turnout. We've been here since about 10:30, and when we got here it was approximately 150 people, and there's still more people coming in. We spoke to the president of the Kiwanis Club of West St. Andrew, Ms. Relda, who spoke of the club's involvement in collaborating with CAOA to bring medicine to their community. We're here with Ms. Relda, who is the president of the Kiwanis Club of West St. Andrew. Can you tell us just a little bit about what it took for you guys to put this together and work in collaboration with the doctors and nurses coming from the States to put this together?
Well, we were invited by Jean Hamilton, which is the contact person with the Jamaican American Ourteach Association, also in association with the Red Hills Citizens Association, which most of our members are a part of, and the Kiwanis Club of West St. Andrew, this is our geographical location. So in that way we were invited to participate. We went to several meetings in order to organize all of this, and here we are today.
Okay, so what do you expect the turnout to be like here today?
Well, we have done 150 tickets already, and those are all exhausted, and we have the Lions Club here, which is separate and apart from that. We have RGD, we have the National Health Fund, and we have the PARTH program, which is here as well.
Okay, so how long have you been doing this?
For the past 4 years. This is our 4th year.
Okay, and is this the biggest turnout so far, or have you seen bigger?
We have seen bigger, but at any one time, this is the biggest. We go up to about 4 o'clock this afternoon, and I suppose all these people are here now. I don't know if anyone will be coming after. No, but this is the biggest at this time, which is now 11:30. We also followed her through her journey as she had an HIV/AIDS test done.
Okay, so we're here at the HIV/AIDS tent, and we saw you just went through the process. What was that like for you?
Well, it was a good experience. I was with the counselor who asked some personal questions, which, I mean, I've never been interviewed for an AIDS test before, and I found it pretty interesting, and I think I have been negligent on my part in protecting myself, and I hope after this I will insist on people to go and get tested, because you really should know your status.
Okay, so how long did they say it would take for you to get your results?
20 minutes. 20 minutes, yes. 20 minutes.
Okay, so do you know they had a pre-counseling? Do they have a post-counseling?
Yes, they will have a post-counseling. I suppose it depends on your results or not.
Okay. So what made you decide to come and get your testing?
As I said, I have never been tested for HIV. I don't know my status, although I think I'm healthy, but you never know, and I think it's a good experience to do. It's a good thing to do. It's good to know your status.
There's still a lot of people coming in, and a lot of them didn't want to speak on camera about why they're here, but as you can see, that they're here for the health services that are being provided here today. We also spoke with Dr. Walters, who told us why he decided to become a part of this charitable organization.
This is my first year with Caribbean Outreach. It's my first year. I've been with Micah 10 years, but this is my first year with Caribbean Outreach.
Okay, so what are some of the most common things that you see people coming in here with?
Well, interestingly, in the first group over the past 10 years, I've noticed that the diseases are mostly diabetes, hypertension. Those are two most common diseases. A lot of eye diseases, eye problems, I think glaucoma, which would probably need an eye doctor to come, and also STDs. But over here, so far as I've noticed in the last couple of days, it's mostly hypertension, and few diabetics. And of course, mostly the kids, pediatrics, are rashes, all different types of rashes.
I just recently learned that healthcare is now free in Jamaica. How do you think this will affect the work that you guys come here to do?
Okay, free healthcare in Jamaica it will help. It will not. I think it will not really largely impact what we do for two reasons. One is that a lot of the people that we see are indigent. They're somewhat marginalized, and although the healthcare is free, they can't get to the healthcare. Okay, so it doesn't reach them, and it doesn't come to them. If however, healthcare was accessible, in that the government was coming to where the people are, some of these people can't even get to where the centers are, and so for them there's no healthcare, although it's free. On the other hand, I think that what we do, we bring an array of not only drugs, but an approach to healthcare. Okay, and that's important.
Okay, we're here with Nikki, and she's a member of the Caribbean American Outreach Association. I see that you're really busy today. What is your role today?
Today, I am the pharmacist, even though I am a registered nurse, but I am playing the role of a pharmacist today.
Okay, so how many prescriptions would you say you've filled thus far?
So far, I would say I filled about, 30.
How many more people are you expecting?
Oh, wow. A whole lot. There's a lot of people still out there waiting. I would say maybe about 150 or so.
We've seen a variety of different illnesses, and I'm sure they've benefited a great deal from what we had to offer today. I'm Keisha Allen with New York Links Zinc TV.